Good afternoon and welcome in our special show, The Vaccine Hesitancy. There are people refusing to take jabs. This time, a video is going viral from Etawah where one woman is seen hiding during a vaccination drive. When health officials approach her, she refuses and is in fear over some rumors she had heard circulating about the vaccine. The video is from Uttar Pradesh. There's an elderly woman there on your screen. She decides to hide behind a drum to dodge the COVID vaccine team, underscoring in many ways the big challenge of inoculating people in rural India. So notice how in this video there is this healthcare personnel, a woman, trying to help this elderly lady understand that there is no fear with the vaccine, but you can sense and understand the fear on the face of the woman as well. There are many people, especially in rural India, who fear getting the vaccine. There are different rumors that have been circulating, and it is beginning to impact some of the people who are not able to verify those claims. And this is, of course, a saddening visual of how the healthcare workers have to not only go door to door, but have to put in extra effort to try and explain to people that they need to get the vaccination done for their own benefit. Even several villages in Bihar are witnessing the vaccine hesitancy. India Today spoke to villagers in Saharsa who are refusing to get vaccinated, claiming they may die after they take the vaccination jab. The administration is trying their best to bust these rumors and myths, but is it really that easy? Take a look.
Misinformation and fake news travel quickly. And when totally baseless reports reach rural India, it becomes dangerous. In Bihar's Saharsa village, people are refusing to take the vaccine. They are convinced it will kill them.
हम लोग को नहीं लगाए हैं।
क्या मतलब किस कारण से नहीं लगाए?
उससे बोलता है आदमी मर जाता है, इसलिए नहीं लगवाए।
मर जाता है इससे? आपको डर लगता है इससे?
जी सर।
क्या चाहते हो फिर?
मरने से तो सबको न डर लगता है सर।
Aman Kumar's view is one that is shared by almost everyone in Saharsa.
नहीं लगाएंगे, हमारा मर्जी है।
सरकार बोल रही है वैक्सीन लगाइए।
बोल रहे हैं जब मर जाते हैं तो आते हैं देखने के लिए। जब हॉस्पिटल पहुंचते हैं हम बेहोश हो जाते हैं तो आते हो देखने के लिए।
41-year-old Pranav Kumar is quite convinced that the government is sending fake doses to villages.
जो ओरिजिनल वैक्सीन है वो तो बेच दिया गया है सरकार के द्वारा, वो गलत वैक्सीन दिया जाता है, क्या लगाएंगे? वैक्सीन लगाने के बाद हम लोग जो देख रहे हैं वो आदमी वैक्सीन लगाने को मरता ही है, क्योंकि ओरिजिनल वैक्सीन है नहीं। वैक्सीन बेच दिया गया है सरकार के द्वारा और गलत वैक्सीन जो है वो उपयोग हो रहा है जनता पर।
Nobody in Saharsa, a village of 1,500 people, is willing to take the vaccine.
घटिया वैक्सीन दे रहा है, इसलिए सब डर रहे हैं। वैक्सीन ले रहे हैं तो बुखार आ जाता है, उसके बाद सही से अभी इलाज नहीं चल रहा है, इस कारण हम लोग भी वैक्सीन नहीं लेना चाहते हैं।
सरकार तो बोल रही है कि ये एक दिन के लिए होता है, थोड़ा बुखार हल्का आ जाता है या बदन दर्द थोड़ा होता है।
सरकार दे रहे हैं, सरकार सही चीज दे रहे हैं, पर यहाँ तक सही चीज नहीं आ पाता है ना।
वैक्सीन तो यही हम देख रहे हैं कि जैसे आदमी लेता है उसके बाद वह बीमार पड़ता है, उसका बाद तो देखते हैं वो मर जाता है, तो वैक्सीन क्या करेंगे लेकर के?
The state government is fighting on two fronts. Firstly, the virus itself, and secondly, in convincing people on the benefits of taking the vaccine shot.
जो नहीं लेना चाह रहे तो हम लोग घर घर जाके समझा रहे हैं उनको, जो लीजिए आप लोग, कोई दिक्कत नहीं है, इससे आप बीमारी से बचिएगा। सरकार हम लोग को बचाने के लिए ना कुछ कर रहे हैं, तो यही इन लोग को दे रहे हैं दिमाग में, लेकिन बहुत लोग के दिमाग से निकला है ये सब बातें।
But move out of villages into towns of Bihar and the situation changes.
ये टीका तो सबको लेना चाहिए, सबके लिए जरूरी होता है ना।
But it's the rural parts which are of concern in the second wave of the virus, which is why the vaccine is so important. It could be the lifesaver in villages which historically lack medical facilities. With Rohit Kumar Singh, Bureau Report, India Today.
Vaccination is the only solution we have for now in fight against COVID-19. But there is this fake news on social media that has been leading to hesitancy in taking the jab. Several people in Kolkata, for example, are skeptical about taking the COVID-19 vaccine. And India Today's Suryagini tells us more.
At nearly 3 crore COVID infections so far, one would expect citizens to line up in thousands to get vaccinated. But not so. Vaccine hesitancy, commonly seen in villages, it turns out is not quite a rural phenomenon. 45-year-old Salim is a trader in Kolkata. He does not want to take the jab and lists many reasons for that.
लोग बोल रहे नहीं वैक्सीन लेने के बाद 2 साल के बाद बहुत से आदमी सोचने के 2 साल के बाद मर जाएगा या कुछ भी होगा और फिर हो सकता है नामर्द भी हो जाए.
Salim's arguments are cut short by his friend, who cites Yoga Guru Ramdev's comments against modern medicine to defend their decision.
जब डॉक्टर और रामदेव बाबा के अंदर में जब वो कन्फ्यूजन नहीं हो रहा है वैक्सीन लेके जो क्या कौन सा वैक्सीन सही है या कौन सा गलत है, तो वो लोग जब डिसाइड नहीं कर पा रहे तो हम लोग जस्ट जनरल पीपल हम लोग किससे हम लोग. आपके घर में किसी ने वैक्सीन नहीं लिया? नहीं, अभी तक नहीं लिया है.
Most of the people India Today spoke had fallen prey to unverified news on social media.
ইন্টারন্যাশনাল চ্যানেলে খবর আসছে যেটা নিলে 2 বছর পর্যন্ত বাঁচবে, এই সমস্ত বিভিন্ন রকম বাঁচতে পারে মানুষ. এটা আমরা একটা ফেসবুকে একটা সোশ্যাল মিডিয়াতে শুনতে পেয়েছি আর কি.
The authorities have a hard task ahead of them, that of persuading people to take the shot.
बहुत आदमी जो लोग चाहते हैं लेने के लिए और कुछ आदमी है, कुछ लेवल के आदमी है जहां ये डर भय फैला हुआ है. सोशल मीडिया के इम्पैक्ट तो बहुत ज़्यादा है. आदमी ये जो बताया था 2 साल में मर जाएंगे, किसी एक नोबेल प्राइज विनर के नाम से आया हुआ था, बाद में वो पता चला इट्स अ फेक न्यूज़.
We spoke to a lot of people over here in Brownfield Market over here in Khidirpur in Kolkata who are of the opinion that vaccines have side effects and a lot of cases have come up where vaccination has caused death. Fake news regarding vaccine has been busted throughout, and over here in Kolkata the state government and the Kolkata Municipal Corporation are trying their best to make sure that people get vaccinated, but there are a couple of people who are afraid to take the vaccines. With camera person Prabir Biswas, this is Suryagini Roy for India Today, Kolkata.
The maximum impact of the COVID pandemic has clearly faced the brunt in rural India, and therefore vaccination needs to be ramped up at the earliest. But there are hurdles as well. The authorities are trying hard to convince people to get the vaccination jabs. For example, villages in Maharashtra, Madhya Pradesh are gripped with fear. They are scared that the vaccines may prove more deadly than the COVID-19 disease itself. Take a look at this ground report.
This is a government official trying to convince the women of a village to get vaccinated. Despite his assurances, the women simply refuse to get a shot. The situation in this village in Madhya Pradesh reflects the hesitancy of those living in rural areas.
नहीं तो वैक्सीन तो हमारा लागी हम ना मर जाते हैं. अबे बुखार आवा थी क्या? अब बुखार ना आई. देख सीएमओ साहब तक तो फिर रहे हैं बेचारे.
The government officials have a daunting task to persuade the villagers, who are gripped with fear.
अभी तक तो वही डर था कि कहीं ना कहीं गलत रहेगा, इस चक्कर में नहीं लगवाई. देखते थे न्यूज़ में या पेपर में कि यार वैक्सीन लगवाने के बाद लोगों के साथ गलत हो रहा है कुछ, तो सकता है कि अपन कमज़ोर है तो इस चक्कर में शूट नहीं करे अपन को भी.
2 लोग जैसे टीका लगा के आए, दूसरे ही दिन 2 मर गए. अच्छे ताजे भले भले आदमी इंजेक्शन लगा के आए, बोले ब्लड प्रेशर बढ़ा, क्या हुआ, एक आजू बाजू वाले दोनों खत्म हो गए.
The Madhya Pradesh government held vaccination camps, but only few people turned up.
अभी जैसे मैंने डबल लगवाई है वैक्सीन, डबल डोज, तो मैंने जब वैक्सीन लगवाई तो लोगों ने बोला बुखार आएगा, कमजोरी होगी, लेकिन ना मुझे बुखार आया और ना मुझे कमजोरी हुई.
On the other hand, the ruling BJP government has blamed the Congress.
अपनी राजनीतिक रोटी सेकने का काम जो कांग्रेस के नेताओं ने किया उसका परिणाम है कि लोगों में कहीं ना कहीं वैक्सीन को लेकर भ्रम है। आप भी नहीं लगवाओगे वैक्सीन?
सर हम तो नहीं लगवा रहे, हम विश्वास नहीं है वैक्सीन। जो वैक्सीन लगवा रहे हैं उनको फिर से भी घबराहट हो रही है।
But the vaccine hesitancy is not limited to Madhya Pradesh alone. In Maharashtra's Chandrapur district, residents of 3 villages have outrightly refused to get themselves vaccinated. This despite the fact that the entire area was declared a COVID hotspot. Both the centre and state governments have directed the local administration to expedite vaccination drive in rural areas. But breaking the chain of fear and hesitancy is proving to be a big challenge. With Ravish Pal Singh in Bhopal and Vikas Rajurkar in Chandrapur, Maharashtra, Bureau Report, India Today.
And as the country battles this COVID pandemic since the past few months, it is specifically the infodemic, the misinformation that's becoming predominant, plunging the village folk into an abyss of fear. It is, of course, very saddening because they are not able to even verify the rumors and claims they are fronted with. The phobia of vaccination, testing stifling in effort to rein in the COVID spread. This time, my colleague Mausami Singh is in Rajasthan. She gets you this ground report from Jodhpur's Shergarh village.
Myths, illiteracy and poverty are big hurdles in rural Rajasthan's fight against the virus. And Chief Minister Ashok Gehlot's home turf Jodhpur is the prime example.
Crisscrossing Rajasthan, now we've reached Jodhpur in West Rajasthan, the second biggest city after Jaipur. Jodhpur is also reeling under the pandemic, especially in far-flung areas like Shergarh, that is about more than 100 kilometers away from Jodhpur. There is a fear that has gripped the villages. We're going to find out why this fear and why the awareness is lacking.
Amolak Ram is mourning the death of his wife, Munni Devi. She was the local Bhupa, a priestess who prayed to folk deities and offered cure for ailments. As the pandemic spread, she was advising people on how to beat COVID.
एकदम खून की कमी के कारण उनको खत्म हो गई। जैसे अस्पताल गए और अस्पताल में जोधपुर रेफर किया गया और रेफर करते हुए भी रास्ते में उसकी जीव दे दिया।
And when she fell sick and died, villagers were shocked.
वो खुद देवी देवताओं के नाम पे लोगों को मतलब झाड़ फूंक किया करती थी और उसी चक्कर में उसने मतलब टेस्ट वगैरह नहीं करवाए, मैं तो मेरे देवी देवता ठीक कर देंगे और लास्ट में ज़्यादा दब गई, यहाँ लेके आए, ऑक्सीजन बिल्कुल डाउन हो गया, ठीक है। उसके बाद में जोधपुर रेफर किया, रास्ते में डेथ हो गई। अब परिवार वाले झूठ बोल रहे हैं।
The Shergarh block of the district had seen more than 80 deaths, but the vaccination drive is facing resistance. People like Chalaram, a shoemaker, are vehemently opposed to taking the jab.
लोग परेशान है, टीका लगाते हैं, वो आदमी एक भी रिया नहीं, सब मर गए, ठीक है ना। इसलिए हमारे 30-35 यहाँ पे घर है, किसी ने भी टीका लगाया नहीं और नहीं चेक कराया और 100-150 रुपए कमाते हैं और जब गुजारा चलता है।
मैं लगाऊं कोई टीका, बहुत डर लगता है टीके का, डर लगता है। क्यों डर क्यों लगता है? टीका उठी सुनते हैं भाई का खत्म हो गया, उठे टीका लंता चढ़े, बुखार आता है, सब भी होता है।
Rumors that people are dying after taking the vaccine are fueling vaccine hesitancy.
टीका लगाया वही मर गया, टीका कहीं लगावे थे, इसलिए टीका नहीं लगाना। या सुनो बस्ती में ज्यादा डर लगे, ज्यादा सपकना हॉस्पिटल जाओ नहीं, ताव बुखार आओ तो घरी गोली लेने बैठ जाओ, के भीड़ लगे, कोई एड़ा आदमी आवे तो अपन ही बीमारी दे दे, तो हम घर से बाहर नहीं निकलते।
मैं तो मजदूर आदमी हूँ, काम पे चला जाता हूँ, कोई आए या नहीं आए मेरे को मालूम नहीं है।
आपको टीका लगवाएंगे तो आप लगवाओगे टीका?
लगवा देंगे और क्या होगा, मरेंगे तो मरेंगे, टीका से मरते वैसे भी मरेंगे।
Health survey teams have visited Shergarh. Efforts are being made to convince people that the vaccine does not kill. But people living on the margin don't even seem to trust the word of outsiders.
In the hinterland, knowledge is the privilege of the rich. Rumors gather momentum and become the truth. Had the government been more alert in spreading awareness, ignorance would have not risen to speculations and fear, putting the most backward communities in a very precarious position. With video journalists Satya Rotre and Ashok, this is Mosmi Singh in Jodhpur for India Today.
From North India to the southern states, the situation is the same. The vaccine hesitancy continues. Now I'm going to take you to Kovalam. It's a fisherman hamlet at the outskirts of Chennai in Tamil Nadu, and there as well people and population of about 14,300. According to reports, only 58 people have got vaccinated in 2 months because many others in thousands are worried about the situation. These are the good souls of the community who have come together, at least devising a plan to remove a bit of these hesitation. There are volunteers from the S.N. Ramadas Foundation, STS Foundation and the Chiraj Trust coming together and deciding to attract people as much as possible by providing a free biryani and other freebies with the vaccine jab in hope that more people will come forth. To make it even more attractive, the team is creating a weekly lucky draw in which 3 people can even stand a chance to win this plate of biryani, grinders, 2-gram gold coins for free. With this initiative, the vaccine drive is picking up. The team has been able to vaccinate more than 350 people. So creativity to get vaccination.
There's about 7,000 people in Kovalam who are eligible for vaccines 18 plus. Our goal is to make sure 100% of Kovalam is vaccinated as soon as possible and make this the pioneer area in India. It's a fun atmosphere rather than making it a sterile hospital atmosphere. People are coming and are quite encouraged and excited, and there's a buzz about the program. So that's kind of what our goal is right now.
Last 3 days we have vaccinated 345 people, and then the schemes which we are providing for the lucky draw, it has been attracted more people, and people are coming forward to take the vaccine exclusively for the biryani and for lucky draw. It's the biggest achievement we are seeing over the eyes right now. So we will be continuing it for lifelong, sir, to create the awareness.
In this area, the bigger problem was to get vaccinated, and that actually turned into an issue because of vaccine hesitation. Imagine in the past 2 months, only 58 people got vaccinated, and this is where good souls from this community came forward and devised a plan by which they were able to bring out 345 people getting vaccinated in just 1 day inside this building. And the plan they devised was very simple. Anybody who gets vaccinated gets a meal, a free meal, could be a biryani, and also this lucky draw. The person who gets vaccinated gets a certificate, and also he signs one of the lucky draw papers, puts inside this box, and he becomes eligible for the gifts that has been displayed over here in a lucky draw that is every week that is being done, and in the bumper draw that is being done, expected to be done in a month period, you get a refrigerator, a washing machine, or even a scooter. So this plan has worked magic in this area, and the actual good souls behind it who belong to STS Trust, C.N. Ramdas Trust and Chiraj Trust, these people claim that their only aim is to give back to their community and make sure that everyone gets vaccinated, and they want to proudly say that Kovalam is the first place in the entire nation which has received 100% vaccination, and that is why they are bringing all these steps to make sure that the people get vaccinated as soon as possible. With video journalist Divyan, Pramod Madhav for India Today.
And this is not just India getting creative to get the vaccination jab. I'm heading into a short break. When I return, I bring you a report from the United States of America, because there, the president